Hello, hello, and welcome to today's live stream. Yeah, hi, and welcome to today's live stream. Today we're talking about 12 warning signs of liver trouble or liver disease that you should never ignore. Now, I don't know if you know this, but liver disease affects over 2 million people worldwide every year and is a leading cause of premature death. Now, what's even most alarming is that most people don't even realize that they've got liver trouble until it's too late. So, for tonight, we're going to be diving into this very crucial topic, and I'm going to be sharing 12 warning signs of liver trouble or liver disease that you should never ignore. Now we're talking about the silent red flags that your body could be giving you right now and how spotting them early could literally change your life. Hello and welcome back to the channel. If you're new here, I'm Diana, and on this channel, we discuss mental health awareness, general health and wellness topics, and everything you need to navigate the challenges of nursing school. If you haven't already, kindly hit that subscribe button and please do like and share this live stream so that it gets to more people. Now, to start, let's talk about why liver health matters. Your liver is one of the most hardworking organs in your body. The liver plays a vital role in keeping you healthy. It detoxifies chemicals, it metabolizes drugs. The liver also produces bile, stores vitamins, aids in digestion, helps with blood clotting, and so many more. But many of us take it for granted until it's too late. And that's because symptoms of liver trouble or liver disease can actually creep in slowly and can be mistaken for other minor issues until serious damage is done. This is the reason why liver disease is often called a silent killer. And so recognizing the warning signs can literally save your life. Now, liver issues are becoming increasingly common due to our modern lifestyles, alcohol use, fatty liver due to poor diet, viral hepatitis, and even environmental factors, environmental toxins. Now, the statistics are also alarming, with thousands diagnosed with liver disease every year. And many of these cases could have been prevented if the warning signs were recognized earlier. So, which is why it is really crucial to be proactive about your liver health. Now, taking care of your liver is essential, but being aware of these warning signs is actually the first step. Therefore, I urge you to watch this video to the end so that together we can change the narrative. Now, without wasting any more time, let's dive in straight into the 12 warning signs of liver trouble that you shouldn't ignore. Now, the first sign I'm going to be sharing is persistent fatigue and weakness. Now, persistent fatigue and generalized weakness are among one of the earliest and most commonly overlooked symptoms of liver trouble. If you're experiencing persistent fatigue, it could be more than just a side effect of a busy lifestyle. Now, what happens is that when the liver is compromised, it struggles to efficiently metabolize nutrients, filter out toxins, and regulate energy production in the body. Now, this inefficiency can lead to a buildup of waste products in the bloodstream, which can leave individuals feeling constantly tired even after a full night's rest. Now, unlike regular tiredness or fatigue that resolves with rest or a lifestyle adjustment, liver related fatigue tends to be ongoing, tends to be unrelenting, and often accompanied by a sense of heaviness or low motivation. Now, this symptom occurs because the liver plays a central role in energy metabolism and detoxification. When it is under strain from conditions like fatty liver disease, hepatitis, or cirrhosis, its inability to properly process these functions can directly affect your physical and mental stamina. Ignoring this kind of fatigue may lead to more serious complications as it is an early indicator of progressive liver damage. The next warning sign is yellowing of the skin and eyes, commonly referred to as jaundice. Now, yellowing of the skin and the whites of the eyes is one of the most recognizable and serious warning signs of liver disease. Medically, this is known as jaundice, and it is a clear indicator that something is off. Now, jaundice occurs when there's a buildup of bilirubin, a yellow pigment that is a byproduct of the normal breakdown of our red blood cells. In a healthy person, the liver processes bilirubin and helps excrete it through bile. But when the liver is inflamed, or it is damaged, or it is blocked, this process is disrupted, leading to bilirubin accumulating in the blood and depositing in the skin and eyes. Now, it is important to note that jaundice is not a disease on its own. It is a clinical sign that the liver is not functioning properly. Jaundice can be linked to a range of liver conditions, including hepatitis, cirrhosis, liver cancer, or bile duct obstruction. In newborns, jaundice can sometimes be benign, meaning that it's not harmful. But in adults, it almost always signals a medical issue that needs prompt evaluation. Now, in addition to yellowing, jaundice may be accompanied by dark urine, pale stools, and itchy skin, which are some other warning signs of liver disease, which we will discuss in more detail as we go along. Ignoring jaundice can delay diagnosis of serious conditions and, in some cases, life threatening liver failure. So, if you or someone you know notices these changes in skin or eye color, it is crucial to seek medical attention immediately. Next, the third sign is abdominal pain and swelling. Now, abdominal pain, especially in the upper right side of the abdomen, it's a very common and important warning sign of liver trouble. Now, this area houses the liver, and discomfort in that area can range from a dull ache to sharp pain, depending on the underlying condition. As liver disease progresses, it may also cause abdominal swelling, a condition known as ascites. This happens when fluid builds up in the abdominal cavity due to reduced liver function and increased pressure in the veins that supply the liver. This is a condition called portal hypertension. And some common causes of abdominal pain and swelling related to liver disease include hepatitis, which is an inflammation of the liver, cirrhosis, which is scarring of the liver, fatty liver disease, liver tumors, or cancer. Now, other signs that abdominal swelling may be liver related include a sudden increase in abdominal size, a feeling of fullness or heaviness, shortness of breath due to pressure on the diaphragm, and then visible veins or a tight, shiny appearance of the skin on the abdomen. These symptoms should never be ignored as they may indicate advanced liver disease or even liver failure. Early medical intervention, as I've mentioned before, can significantly improve outcomes. Next, at number four, the fourth warning sign of liver disease is nausea or vomiting. Now, feeling sick, especially after meals, may not necessarily be food related. It could be your liver struggling to digest fats or clear toxins. If you feel nauseated or you experience frequent vomiting, it can be more than just a sign of a stomach bug. It may actually signal that your liver is in trouble. Now, why is this? The liver plays a crucial role in detoxifying the blood, in metabolizing nutrients, and processing medications and hormones. Now, when the liver becomes inflamed or damaged, whether from fatty liver disease, whether from hepatitis or alcohol use or even cirrhosis, its ability to process toxins and digestive byproducts becomes really impaired. Now, these substances can then begin to build up in the body, leading to digestive disturbances like nausea and vomiting. Now, there are some key points to consider. Persistent or unexplained nausea, especially when it's not linked to food poisoning, pregnancy, or any known gastrointestinal tract issues, should raise concern. Then, vomiting may be accompanied by other liver related symptoms like jaundice, fatigue, or abdominal pain. Thirdly, the accumulation of waste products and altered metabolism can also impact the brain and the gastrointestinal system, worsening these symptoms over time. So, while nausea and vomiting can be caused by many other conditions, if they persist and are coupled with other signs of liver distress or liver trouble, they warrant prompt medical evaluation. The fifth warning sign of liver trouble or liver disease is dark urine and pale stool, like I mentioned earlier. Now, changes in the color of your urine and stool can be an early and really important sign of liver dysfunction that should never be ignored. Now, under normal conditions, the liver produces a yellowish substance called bilirubin. Bilirubin is broken down and excreted in stool, giving it that healthy brown color. Now, when the liver is damaged or its bile ducts are blocked, whether due to hepatitis, cirrhosis, gallstones, or liver tumors, bilirubin may then begin to build up in the blood instead of being processed and eliminated properly. So when this happens, here's what you might notice. So you might notice dark urine, so a deep amber, cola, or tea-like color in your urine, even when you're well hydrated. If you notice this, it might be an indicator of excess bilirubin being excreted through the kidneys rather than through the digestive system. The other thing you may notice is pale, clay colored or whitish stools. Now, what this suggests is that there's low bile output, which is a hallmark of liver or bile duct issues. Now, normally, these signs often appear before more visible symptoms like jaundice, making them valuable early indicators of liver trouble. So please, if you notice both dark urine and pale stool, especially if it's accompanied by fatigue, nausea, or yellowing of the skin, it is critical to seek medical advice immediately. Moving forward, the next sign of liver trouble or liver disease to look out for is bruising easily or having bleeding gums. Now, this is one of the most often overlooked yet significant signs of liver disease. If you're experiencing unexplained bruising or bleeding, especially from places like the gums, please do not ignore. The liver plays a vital role in producing proteins that are necessary for blood clotting. Now, when liver function declines due to conditions like cirrhosis, hepatitis, or fatty liver disease, the production of clotting factors diminishes. Now, this can lead to easy bruising, even from minor bumps or without any obvious cause. It can also lead to frequent nosebleeds or bleeding gums, especially during brushing or flossing. It can lead to prolonged bleeding from small cuts as well. So if you find that you're bruising more easily than usual, or your gums bleed regularly despite good oral hygiene, this could indicate impaired clotting function, and it's a huge red flag pointing to potential liver dysfunction. Now, these symptoms often go unnoticed or sometimes are misattributed to vitamin deficiencies or dental issues. However, when these symptoms are seen in combination with other signs like fatigue, yellowing of the skin, which is jaundice, or dark urine, they require urgent medical attention. Now, the seventh warning sign of liver disease that you should not ignore is itchy skin without a rash. Now, persistent itchy skin without any visible rash is an early but really frustrating sign of liver disease, particularly cholestatic liver conditions like primary biliary cholangitis or primary sclerosing cholangitis, PBC or PSC. Now, these conditions affect the bile ducts and cause a buildup of bile acids in the bloodstream. Now, when the liver is not processing bile properly, bile salts accumulate under the skin. This is what leads to intense itching known as pruritus. This kind of itch most often worsens at night. It commonly affects the hands, feet, arms, and legs. It occurs without a visible rash or any skin irritation, and it may lead to scratching injuries or secondary skin infections due to its intensity. Now, many people would dismiss chronic itching as an allergy or skin condition. But please note that when it persists without an obvious cause or a rash, and especially if it is accompanied by other signs of liver disease like jaundice, dark urine, or fatigue, it should prompt further investigation into your liver function. Now, if left unchecked, the underlying liver disease can progress. So, recognizing pruritus as a systemic warning sign rather than a surface issue is crucial. So, please, my advice would be Don't dismiss this, especially if it's persistent and widespread. Now I've shared 7 warning signs of kidney disease to not ignore. But before I share the 8th warning sign, do me a favor. Please like and share this video with someone who might need it. And don't forget to subscribe if you haven't already for more valuable health and wellness content. Now, moving forward, at number 8 is swelling in the legs and ankles, also known as edema. Now, swelling in the legs, ankles, and sometimes the feet, known medically as peripheral edema, can also be an important warning sign of liver disease, particularly advanced or chronic liver conditions like cirrhosis. Now, when the liver is no longer functioning properly, it struggles to produce albumin, a protein that helps maintain fluid balance in the blood vessels. Without this protein, without enough albumin, fluid leaks into surrounding tissues, causing visible puffiness and swelling in the lower extremities. Now, some key characteristics of liver-related edema to look out for include soft pitting swelling. So what this means is that when you press the skin, the area that is swelling, a dent remains. Another key characteristic is that it's usually worse in the evenings or after prolonged periods of standing. It is another key characteristic is that it's often not accompanied by pain unless it is severe. It may occur alongside abdominal swelling, which is ascites. And while leg and ankle swelling can also result from heart failure, kidney disease, or varicose veins, when it occurs with other signs, other liver disease signs like jaundice, fatigue, or abdominal bloating, it may point to compromised liver function. So, edema should never be ignored, especially if it's persistent or unexplained. It's what it signals is that the body's fluid regulation is impaired, often due to underlying liver damage that requires medical evaluation and management. The 9th warning sign is loss of appetite or sudden weight loss. Now, not feeling hungry or losing weight without trying may seem good, but it's actually a major red flag, especially if paired with other symptoms. Any noticeable loss of appetite, often accompanied by unintentional weight loss, is a significant and oftentimes an early warning sign of liver trouble. Now, why does this occur? This occurs because liver disease can interfere with digestion and metabolism, leading to reduced interest in food, a feeling of that feeling of being full really quickly, and it can also alter our taste perception. Now, when the liver becomes inflamed or damaged, its ability to process nutrients, produce bile, and regulate hormones declines. And this disruption can cause persistent nausea or queasiness that reduces our food intake. It can also cause a feeling of fullness after eating small amounts of food. It can lead to loss of muscle mass or muscle wasting, especially in chronic liver conditions. Or it can also lead to a general lack of desire to eat, even when you're physically hungry. Now, in advanced liver disease, this symptom is often part of a broader condition known as hepatic cachexia, where both fat and muscle mass are lost, significantly affecting a person's strength and immunity. Now, while appetite changes can result from many causes, when they occur alongside other liver related symptoms like fatigue, jaundice, or swelling, whether abdominal swelling or swelling in the extremities, they become especially concerning and should prompt a medical assessment. Next is the 10th sign, which is confusion or memory issues, also known as hepatic encephalopathy. Now, this is one of the most serious and potentially dangerous warning signs of liver disease. It comes with confusion, forgetfulness, difficulty concentrating, or even personality changes, symptoms that may indicate a condition known as hepatic encephalopathy. Now, this condition occurs when the damaged liver is no longer able to effectively filter out toxins, especially ammonia, from the bloodstream. Now, these toxins then accumulate and they travel to the brain, leading to neurological and cognitive impairments. Common symptoms of hepatic encephalopathy include mental fog, so difficulty focusing or just feeling off. It can also lead to short term memory loss or forgetting familiar information. It could lead to disorientation, such as not knowing the date or a location. It could lead to irritability, mood swings, or personality changes. It could lead to sleep disturbances, including sleeping during the day and being awake at night. And in severe cases, it can actually lead to slurred speech, tremors, or even lead to a coma. Now, these symptoms may develop gradually or they may just come up suddenly and they can fluctuate in severity. It is important to note that hepatic encephalopathy can be reversed or managed, especially if it is caught early. But when it is left untreated, it can become life threatening. So please, if you or someone you know begins experiencing unusual cognitive or behavioral changes, especially in the presence of other liver related symptoms like jaundice or swelling, please seek immediate medical evaluation. The 11th warning sign of liver disease is spider angiomas and skin tags. Now, spider angiomas and skin tags are visible changes to the skin that can signal liver disease, particularly when they appear suddenly or they appear in combination with other symptoms of liver dysfunction. So, I know you'll be wondering, what are spider angiomas? Now, spider angiomas are small, red, web-like clusters of blood vessels that appear just beneath the skin. They in Obviously in dark skin they will not appear quite red, but they are often seen on the face, on the neck, upper chest, and hands. Now, these formations have a central dot with small legs radiating outward, resembling a spider's web. The presence of spider angiomas can indicate increased estrogen levels in the blood, which is common in people with liver disease such as cirrhosis. Now, why does this occur? It occurs because the liver, when impaired, can't metabolize estrogen effectively, leading to its accumulation in the blood. Now, spider angiomas are particularly prevalent, that is to say, they occur frequently in cirrhosis, which is scarring of the liver, and they are often one of the early signs of liver damage. Skin tags, on the other hand, are small, soft, hanging growths of skin that commonly appear on the neck, underarms, and groin area. Now, While skin tags themselves are usually harmless, their appearance can be linked to liver disease, especially in conditions where insulin resistance is a factor, such as non-alcoholic fatty liver disease. Now, our livers play a key role in regulating blood sugar levels, and when it becomes damaged, insulin resistance can occur, leading to the development of these benign growths. Now, why do these signs matter? Both spider angiomas and skin tags may seem like simple cosmetic issues, but their presence in conjunction with other liver related symptoms should not be ignored. They can actually be indicative of a deeper underlying liver issue that may require medical attention. So if you notice the sudden appearance of spider angiomas, or you notice a sudden increase in skin tags, especially alongside other symptoms such as jaundice or abdominal pain, it is crucial to not ignore it and get medical advice as soon as possible to address potential liver dysfunction early enough. And the last but not the least warning sign of liver disease that I'm going to be sharing in this video is bad breath, also known as fetal hepaticus. Now, fetal hepaticus is a distinct foul smelling breath that is often described as having a musty or sweet odor, sometimes likened to the scent of rotten fruit. Now, this condition is a significant warning sign of liver disease, particularly in advanced stages such as cirrhosis or liver failure. Now, why does it happen? Fetal hepaticus occurs when the liver is no longer able to properly process and detoxify substances in the blood. As liver function deteriorates, ammonia and other toxins build up in the bloodstream because the liver is unable to filter them out. These toxins, particularly ammonia, are then released through the breath, causing that characteristic foul odor. Now, this is actually connected to hepatic encephalopathy, because it's often seen in patients who have this condition. And like I mentioned before, this condition results from the accumulation of toxins in the brain due to liver dysfunction. When the liver cannot effectively remove toxins like ammonia, they build up in the bloodstream and affect the brain, leading to confusion, memory issues, and changes in mental status. The presence of fetal hepaticus is often considered a late stage sign of liver disease and can actually signal that liver failure is imminent, making it essential to seek immediate medical attention. Now, what do you watch out for? Distinctive odor. The breath in this condition usually has a musty, sweet, or sometimes even a fishy smell. Other symptoms. So, if fetal hepaticus is present alongside other symptoms like jaundice, abdominal pain, or confusion, it is a clear indication that liver disease could be in an advanced stage and needs to be addressed urgently. Why should you not ignore this? The presence of fetal hepaticus is often one of the final warning signs that liver disease has progressed into a serious and potentially life-threatening stage. Early recognition and treatment are crucial to prevent further liver damage and complications at this point. So if you notice this unusual breath odor, especially in conjunction with other liver-related symptoms or warning signs, it is essential that you seek medical advice promptly. Now, in this video, I've shared 12 warning signs of liver disease. Now, at this point, it's important to note that while all of these 12 warning signs matter, 4 of them are actually the most critical warning signs and should ring immediate alarm bells when observed or experienced. And these 4 are the yellowing of the eyes and skin, which is the jaundice, the swelling in the abdomen or in the legs, in the extremities. Thirdly, the bleeding gums or excessive bruising. And the fourth one is confusion or memory lapses. Now, ignoring any of these signs, these 4 critical warning signs, could lead to severe liver damage like cirrhosis or even liver failure. If you or someone you know is experiencing 2 or more of these 4 warning signs that I have just listed, please don't wait. See a healthcare provider immediately. Early detection and diagnosis are crucial. It can make all the difference between just an easy fix and a lifelong battle with liver disease. Now, as I round up today's live stream, the key takeaway I want you to from this video is that liver health should not be taken lightly. It is important that if you notice any of these 12 warning signs, and especially the 4 most critical warning signs out of the 12 that I've mentioned, you should never ignore this. You should never ignore them. So let's recap the 12 warning signs of liver disease that you should never ignore. One of them, the first one is persistent fatigue. 2 is jaundice. 3 is abdominal pain and swelling. 4 is nausea or vomiting. 5 is dark urine or pale stool. 6, easy bruising or bleeding gums. 7, itchy skin. 8, swollen legs or ankles, also known as edema. 9, appetite or weight changes. 10, confusion or memory issues. 11, spider angiomas or skin tags. And 12, bad breath, also known as fetal hepaticus. Remember, your liver is working 24/7 to keep you alive. Take care of it by paying attention to your body and taking action if you notice any of these symptoms. So before I go, I hope you got value from this video. And just in the comments, if you or a loved one has experienced any of these warning signs, or if you have any concerns about your liver health, share in the comments below. Let's raise awareness. Someone might read your story, someone might read your comment and decide to get checks. And please don't forget to check out my other health related videos for more valuable information and tips for keeping your mind and body in tip top shape. Thank you so much for tuning in tonight. Stay healthy, stay informed, and I'll see you in the next one. Bye.